This is our project on fluorine and dental caries. In the early 20th century, there was a dental disease that involved a mottling of the enamel in many residents of the southwest United States, although other areas of the United States were affected as well. Those affected could have brown spots on the surface of the teeth. The disease was not medically significant, but had significant cosmetic impact for some. When McKay and Black set out to study it in the early 20th century, it was different than the epidemiology of other infectious diseases because it could not spread from person to person. Infectious diseases can be studied by how they spread from person to person and what mode the pathogen uses to travel, but ME was different. Its prevalence varied widely in areas that were geographically close together, and there was little evidence of infectious spread. McKay and Black therefore had to study this disease in a different way than one would study infectious agents. A retrospective study looks into the past by gathering historical data on patients related to their exposures and health outcomes. A prospective study looks at future outcomes of patients. For example, a prospective cohort study compares two groups. One has had an exposure to some kind of risk factor, and the other control group does not. Then the examiners look to see which group develops disease. Prophylactic therapeutic trial is a study which involves giving a therapeutic treatment to humans. One group receives the treatment and another receives the control to determine the efficacy and toxicities of a potential new treatment. An observational study involves only observing patients without initiating any kind of treatment. A natural experiment. This is a type of study that occurs when groups of individuals are exposed to some kind of risk factor in a way that resembles random assignment, but this determination is not decided by investigators. This is useful when there is a clearly defined exposure to a specific population of people, and is useful when artificially creating this exposure would be too difficult or immoral. A cross-sectional study collects data from people to assess frequency of a disease at a particular point in time. It may show associations, but not causality. Investigators initially performed an observational study of ME by collecting observations and impressions of dentists in the area. They also sent out a questionnaire to parents. They found that the disease was a developmental failure of the enamel rod cementing substance. The disease occurred largely in children over 9 and young adults and did not seem to be related to hygiene. The lesion was permanent. Most agreed the cause was either something harmful in the water or a lack of something necessary in the water. They did not determine what this substance might be at the time, despite chemical analysis.
Figure 1 of the article provides a graph showing the index of dental fluorosis versus the fluoride content of communal water supply. The index may have been calculated by looking at the degree of fluorosis when examining damaged teeth compared to healthy teeth. There are several criteria for establishing causality. The first is temporal relationship, where there must be an exposure preceding the outcome. If someone believes a certain factor causes a certain outcome, then that factor must always precede the outcome. Strength means the stronger the association between a cause and effect, the more likely the relationship between the two is causal. Dose-response relationship means an increase in the amount of exposure increases the risk of the outcome. Consistency means the association is consistent when the results are replicated. Plausibility means that there must be a theoretical basis for establishing the association. Consideration of alternate explanations means other explanations for the phenomena must be taken into account to rule out alternate explanations. Experiments must be performed to support the association. For specificity, altering only the cause alters only the effect. And for coherence, association should be compatible with existing knowledge. When looking at Figure 1, a strong positive trend is seen graphically. However, only the incidence of disease is shown. Alternative explanations and factors are not explored. Therefore, it is not very convincing that the association is due to causality. The results could just be correlational instead of causal as an alternate explanation. The study design used in the University of Arizona's experiment was a prophylactic therapeutic trial.
Gordis defines bias as a systemic issue that can be found at any step of a study and results in an inaccurate estimate of how an exposure affects a disease. Randomization of a trial means that the investigators assign participants to the study group and control group in no particular pattern or association. Randomization is done to reduce bias. Blinding is the act of making study participants unaware of which group, control or experimental, they belong to. This is often done using a placebo for the control group. A double-blind study also ensures that those who collect the data and analyze it are unaware of which group each participant belongs to. Blinding is also done to reduce bias. In regard to these data on the association between fluoridation of drinking water and dental caries, we would wonder if there were biases present. This particular study was a retrospective cohort study. Therefore, randomization was not done as participants were assigned to groups based on previous data on exposure status. The exposure in this case was fluoridation levels, which were obtained retrospectively. Questionnaires might have been given out, or they may have obtained participants through phone calls. In either case, these methods could be a source of bias due to a potential difference in association between fluoridation and dental caries in those who did not respond to the questionnaires or phone calls and those who did. While the study does not mention this, the person responsible for evaluating the dental caries might have known the status of the fluoridation of the children prior to examining them, and this could also introduce bias. This study chose participants that were white children aged 12 to 14 with continuous exposure to a communal water supply since birth without interruption of more than 30 days of any year. The investigators were curious about exposure to fluoride at different concentrations, so it was important to ensure that exposure to a concentration of fluoride was consistent and for the same amount of time. This is why they looked at a population of children in a small age range using the same water sources without interruption of use of the water source for more than 30 days of any year. The investigators might have chosen to look exclusively at white children in the study because of the socioeconomic differences between races at that time that would have meant variations in dental care or water supply.
Observer variation is defined as the failure by the observer to measure or identify a phenomenon accurately, which results in an error. Sources for this may be due to the observer's missing an abnormality or to faulty technique resulting in incorrect test measurement or to misinterpretation of the data. There are two types of variation. Inter-observer variation is defined as the variability between observers reporting on the same material. Intra-observer variation is defined as the variability by one observer between observations on multiple reports of the same material. For Dean's study, he did a retrospective correlational study, and this is defined as a study conducted in specific population groups having specific characteristics in a specified geographical area. Dean's findings from the study was that fluoride concentration correlated with a decrease in presence of dental caries. The next logical step for Dean is to perform an experimental study. The retrospective study only shows an association, not a causal relationship between fluoride in drinking water and dental caries.
A crucial balance must be struck between enough fluoride intake to prevent dental caries, which appears to be in the range of greater than 1 part per million fluoride, while also preventing fluoride toxicity, also known as mottled enamel, also known as dental fluorosis, which seems to occur at concentrations greater than 2 parts per million fluoride. The CDC recommends daily fluoride intake between 0.7 to 1.2 parts per million, depending on the average maximum daily air temperature in the region. This study follows two similar groups of children over time, comparing their relative fluoride exposures and the resultant effects on dental health. The study has a clear information bias as the Muskegon status as a fluoride-free control changed before the study's 10-year conclusion, yet the advantages of water fluoridation seem evident in the results from Grand Rapids, Michigan, and Aurora, Illinois. The study is also open to selection bias, a sampling selection bias in particular, in which results can be skewed by the overrepresentation of individuals who have sought out dental care in the past and therefore have healthier dental statuses. Fluoridation of water at 1.0 parts per million shows a clear benefit for subjects included in the study, as it increases the incidence of dental health, specifically decreasing incidences of decayed, missing, or filled teeth, while increasing incidence of dental carie-free individuals.
When designing a study, it is important to consider the advantages and disadvantages of both prospective and retrospective studies. While both study designs have an important place in the arena of evidence-based medicine, their differences need to be considered. The biggest advantage of doing a retrospective study is that the time and cost investment is much lower than what it is to complete a prospective study. However, because you are starting with the population that has the outcome being investigated, it is difficult to say if certain variables are actual risk factors or just correlate with the disease. Retrospective studies are also relying on old records, which may be missing pertinent patient information. The biggest advantage of doing a prospective study is the ability to look at a specific population longitudinally and determine risk factors for disease. Because of this, prospective studies are ranked above retrospective studies in the hierarchy of medicine, but they require huge investments of time and money before any results can be had. Fluoridation has several proven positive upsides, and as long as levels are kept below limits, no documented negative effects. With this in mind, I would recommend fluoridating my community's water supply if it has not already been done.